Hello, my name is Janelle. I am a Gtube nurse. If you were given a spare mick long Gtube and told to use it if your child's GJ tube falls out, this video will show you how to place the Gtube. Putting the Gtube in will help keep the opening from shrinking. The opening is also called the stoma or tract, which is where the tube goes in. The Gtube can be used to give feedings or medicines if your child can handle them in the stomach. This Gtube will only be used until your child's GJ tube is replaced in the imaging department. A mick long Gtube is a feeding tube. It is held in the stomach by a water balloon. It has a stabilization disc which allows a better fit on people of all sizes. If your child's GJ tube comes out all the way of the tract, cover the stoma with gauze or a washcloth. This will stop the food from coming out. Get your supplies. You will need the mick long Gtube, lubricant, slip-tip syringe, water to fill the balloon. Bottled water is best. And then tape. Wash your hands with soap and water. Get the Gtube ready. Pull the stabilization disc up toward the top of the tube. Put lubricant on the balloon tip of the tube. Draw up the correct amount of bottled water into the slip-tip syringe. Look on the balloon port for the amount needed. Gently ease the Gtube 1 to 2 inches into the tract. Put the syringe of the water into the balloon port of the tube. Push the plunger to fill up the water balloon. Remove the syringe. Gently pull up on the tube until it feels like it will not come up anymore. This means the balloon is snug against the stomach. Push the stabilization disc down so that it rests gently against the skin. Secure the tube. Wipe away the extra lubricant from the skin. If you will be giving medicine or feedings through this tube, check to make sure the tube is in the right place. Put an empty syringe into the feeding port. Pull back on the plunger until you see gastric juices or formula. Close the feeding port. If you are unable to pull back any gastric juices or formula, do not use the tube. Keep the tube in place until a GJ tube is able to be replaced. If you are not able to place the Gtube, call the imaging department or your child's doctor for more instructions. Do not force the tube in the tract. If you are having a hard time placing the Gtube, stop. If you are able to, try to get the tip of the tube a little into the tract. Tape the tube to the skin to keep it from falling out. If you were able to place the Gtube in the child, now what do? Most children can go without feedings or liquids for 12 hours without any harm. Some children may need IV fluids. Your child may need to be admitted to the hospital until the GJ tube can be replaced. This depends on your child's age and special medical needs. Do not come to the emergency room unless needed. If you come to the emergency room in the evening or overnight, your child's GJ tube will not be replaced until the next day. It is best to call the imaging department if you do not know what to do. If your child can make it through the night, call the imaging department the next morning to have the GJ tube exchanged. If your child is not able to make it through the night without food, liquids, or medicines, call the doctor who manages your child's feedings. Thank you for watching.